Good morning, Dr. Jeffrey Picciarello from Ocala, Florida. I was doing my morning reading and I came across a very interesting article. I think it's interesting because of the outcome, but I also think it's interesting historically. This is a brand new article published just last month in October of 2021 in a very prestigious journal, in the Journal of Shoulder and Elbow Surgery. And it's a meta-analysis looking at the treatment of lateral epicondylitis or tennis elbow and comparing both treatments with local injections of PRP to surgical intervention. And the reason I think it's interesting is the outcome is very interesting because it shows that both treatments actually have equal outcomes. But I think it's more interesting historically. I started doing PRP in 2002, about 10 years into my orthopedic practice. I was lucky enough that one of the major joint replacement companies was having an interest in PRP, and their rep rolled a centrifuge into my operating room and asked me if I could use PRP to augment bone graft around joint replacements and in hard-to-heal fractures and in spine fusions. And so we started collecting data for the company. Once we saw that it was working very well in these indications, a lot of it started to expand the indications, and we are adding it to our rotator cuff repairs and our Achilles tendon repairs. And then probably about 5 years later, around 2007, 2008, some of us actually brought it into the outpatient setting and started using it in our offices. One of the first reported cases was a orthopedic surgeon by the name of Dr. Lamb, who actually injected his own tennis elbow with PRP. And that story began to spread through the orthopedic community. He had good results, and it took care of the pain, and a lot of orthopedic surgeons started using that as an indication to treat their own patients. So this article has actually come full circle. 20 years later, a meta-analysis looking at 340 patients, 154 of which were treated with PRP and 186 treated surgically. And if we scroll all the way down to the conclusions at the bottom, it says that local platelet-rich plasma injections and surgical treatments produced equivalent outcomes. So they had equivalent pain scores post-treatment and equivalent functional outcomes. Now, obviously, this article is written by surgeons because the next line I find kind of comical even as a surgeon. It said that platelet-rich plasma injections may represent a reasonable alternative to patients who are apprehensive to proceed with surgery. It actually should say that PRP should be used as a first-line treatment to keep people out of the operating room, but surgeons are surgeons and they want to do surgery. So I think it's interesting the way that it was worded, but the outcome is still the same, that PRP is a great option to treat people with tennis elbow or what's called lateral epicondylitis. With that being said, I know a lot of you are already doing PRP. You may be using it for aesthetics or in sexual health or in hair growth. If you are not using it for orthopedic problems, I do offer a monthly workshop. It's called Perfect PRP Joint Injection Workshop. I am lucky enough to teach it out of the office of Dr. Charles Runnels in Fairhope, Alabama. Many of you know Dr. Runnels is the innovator of the vampire procedures, vampire facelift, vampire facial, as well as the O-shot and P-shot. And we have come together to offer joint injection techniques and a joint injection workshop out of his office monthly as well. If this is something that interests you and you would like more information, below this video you will find a link to the complete article that we're discussing, as well as a link to more information about the joint workshops. I hope everyone is doing well. I hope you're having a great week, and I'll come back to you in a week or so with another video. Have a great week, and I'll talk to you all soon. Thanks. Bye-bye.